Here's a graft versus host disease, GvHD, USMLE style question for you. A 35-year-old woman with acute leukemia undergoes an allogeneic bone marrow transplant from a human leukocyte antigen, HLA, matched sibling donor. Several weeks after the procedure, she develops a rash, diarrhea, and jaundice. Skin biopsy reveals an infiltrate of T lymphocytes in the dermis. Which of the following is the most likely cause of this patient's symptoms? A. Autoimmune attack against the patient's own tissues by donor T cells. B. Inflammatory response to bacterial infection due to immunosuppression. C. Activation of donor T cells against recipient's tissues, graft versus host disease. D. Rejection of the transplanted graft due to HLA incompatibility. E. Infiltration of the skin and liver by cancerous leukemic cells. Answer and explanation. The correct answer is C. Activation of donor T cells against recipient's tissues, graft versus host disease. Graft versus host disease, GvHD, occurs when donor T cells recognize the recipient's tissues as foreign and mount an immune response against them. This typically happens after allogeneic bone marrow or stem cell transplantation, as in this patient with leukemia, where the donor's immune cells attack the recipient's tissues. The characteristic symptoms of GvHD include skin rash, diarrhea, and jaundice, which are seen in the acute form of the disease. Option A refers to autoimmune diseases, where the body's own immune system attacks its tissues, which is not the mechanism in GvHD. Option B could be a possible complication, but this patient's symptoms are more typical of GvHD than a bacterial infection. Option D refers to graft rejection, which typically occurs due to differences in HLA between donor and recipient. GvHD is more commonly associated with HLA compatibility. Option E would involve leukemic infiltration of organs, but this patient's symptoms are more consistent with GvHD rather than recurrence of leukemia. Key takeaway: graft versus host disease occurs when donor T cells attack the recipient's tissues after allogeneic transplantation, leading to symptoms such as skin rash, diarrhea, and jaundice. Let me know if you'd like further